This conference will now be
Who is
recorded.
corona? Who is corona? The corona is a virus, and everyone is having fear of this coronavirus in their mind. For that, we are taking care of ourselves, our family, and all the society. The air around us is filled with millions of microorganisms, such as bacteria, fungi, viruses, and protozoa, etc. Almost 30% of our household dust are contributing by these microorganisms. Means whenever we are the number of microbes range from 10 to 10,000 per cubic meter. Means these microorganisms are n number of microorganisms present in the air, on the surface, in house, in hospital, everywhere in the medical field, laboratories, like laboratories. So how they live, how they live. They live at temperature less than 20 degrees Celsius, temperature hotter than the boiling point, where there are some microbes which needs moisture to live and reproduce. Often when people think about microbes, they think of disease also, but all the microorganisms are not pathogenic. Some microbes are non-pathogenic. So among the total microbes, 20 to 25% are non-pathogenic. Remaining microbes residing air are responsible for various diseases. So the bacteria, viruses, fungi, spores, all these are causing the diseases, the different diseases. Some bacteria, they are causing respiratory diseases. Some bacteria, they are causing elementary diseases. The viruses, they are causing the different diseases. I'm telling you first about virus, bacteria, and all these microorganisms before their sterilization, because to whom we are going to sterilize. Sterilize the our surfaces, our instruments, our clinics, our operation theater for these positive organisms, positive pathogens. The common bacteria and viruses which are causing hospital acquired infection (HAI). So hospital, here I noted hospital acquired infection because in hospital there are some common bacteria. Among these, Acinetobacter baumannii, these are the names: Bacteroides, Fragilis, Rhododelia, Cepacia, Clostridium, Sordelli, Enterococcus facialis, Escherichia coli, hepatitis B. We know hepatitis B, hepatitis C, hepatitis A, and the dangerous viruses, human immunodeficiency virus. But I think nowadays corona is, I think, very dangerous than immunodeficiency virus because everyone is having fear, so much fear in their mind because of coronavirus. The other influenza, Klebsiella pneumoniae, methyl, methyl, methicillin resistant Staphylococcus aureus, Mycobacterium abscessus, Pseudomonas aeruginosa, Stenotrophomonas microfilia, Mycobacterium tuberculosis, vancomycin-resistant Staphylococcus aureus, and vancomycin-resistant Enterococcus. So these are the few names, but there are n number of bacteria and viruses. These bacteria and these viruses are few which are commonly we get in our clinic, in our hospital, and some of the bacteria we get in pathology, some other bacteria we get in our house. So for these bacteria and viruses, we need to sterilize, we need to fumigate, we need to decontaminate our surfaces, our hands, our hospital area, our wards, our operation theaters. So achieving disinfection and sterilization through the use of disinfectant and sterilization practices is essential for ensuring that medical and surgical instruments do not transmit infectious pathogens to patients because it is necessary to sterilize all patient care items in healthcare policy. Here, why we need to fumigate, we need to discontaminate because the infectious diseases which are caused by pathogenic organisms and these pathogenic organisms are everywhere present, mostly in our clinic, in our hospital. So we need to,
Dr. Shah, Dr. Shah, sir, there is a pictures. The
yes,
slides are not clear. Is the screen visible to all attendees?
Yes, sir. Yes, sir. Thank you very much.
okay. So come to the point, we need to take care of our patient. We need to take care of diseases which are caused by these pathogenic organisms. We need to kill these organisms. We need to kill bacteria, viruses, fungi, and spores. So, how do we achieve this sterilization and disinfection, or how can we kill these bacteria and viruses? So, first thing is to taking care from these bacteria and viruses. We need to protect ourselves first. When you protect ourselves, we can automatically protect the other persons, the society, our patient, and all persons. So, how we do the sterilization? There are methods of sterilization or disinfection. There are mainly three types of sterilization method, that is physical method, chemical method, and physiochemical method. Where in physical method, sunlight, heat, vibration, and radiation and filtration, these are the fighters. The first is sunlight. So, as I told before, some bacteria which are killed by some heat or the sunlight which is coming and the heat produced by sunlight. In that sunlight, some bacteria they automatically kill because of the heat produced by sunlight. Then heat, the actual heat. So how do heat? There are two types, dry heat and moist heat. So there are further 4 to 5 types in dry heat. We can give red heat by red bulb, by flaming. Third one is incineration. Incineration. Fourth one is hot air oven. As everyone is using oven in our house. working of our house or oven and this oven is near about equal because we are regulating the temperature in oven. Here also we have to regulate the temperature and we have to sterilize the items that are kept in the oven. And the fifth one is infrared. The, this is types of dry heat and the moist heat sterilization in which we can sterilize the items, instruments, all medical equipments in below 100 degrees Celsius. There is one type. Why below 100 degrees Celsius? Because some bacteria, some viruses, we can kill at this temperature. And second one is at 100 degrees Celsius. At exact 100 degrees Celsius. Uh, I tell you the boiling point of our water. Boiling point of water is 100 degrees Celsius. So means we can kill the bacteria, pathogens, uh, fungi and spores. It's at this 100 degrees Celsius temperature. And third one is above 100 degrees Celsius. Why we need above 100 degrees Celsius temperature to kill the bacteria? Because some bacteria are heat resistant and some bacteria needs uh, above 100 degrees Celsius temperature to kill. So third one above 100 degrees Celsius. Uh, we need this temperature to sterilize our equipment and instruments. Then vibration. Vibration is one of the type we can do the sterilization by vibration method. So there is one method, and fourth one is the radiation. So there are again two types: non-ionizing radiation and ionizing radiation. These are the main types. Where ionizing radiation, there are further two types: electromagnetic and particulate. These are the further two types. So radiation, we know radiation, where we use radiation, we use radiation therapy in cancer patient to kill the cells, to destroy the cancer cells. This is the radiation method we are using as a sterilization method. And fifth one is the filtration. So how do we filtrate the bacteria? Because bacteria has some their unique size. There are different size of bacteria, viruses. Because we know this corona, even not corona, but all viruses, we cannot see by our open eye. We have to see under the microscope. These are in very small. These are very small. We cannot see. So, in this filtration, earthenware, asbestos, centered glass, and membrane are used to filtrate the bacteria and viruses. The second common uh, sterilization method is chemical sterilization method. And nowadays we are going through this chemical sterilization or chemical sanitization method. We day to day in our practice nowadays we sanitize our hands, we sanitize our table, we sanitize our dining table, each and everything what we are using in our clinic. We sanitize with alcohol or sanitizer. So in chemical sterilization method, there is one liquid sterilization in which we use alcohols, aldehydes, phenolics, halogens, heavy metals, surface acting agents, and dyes. These are liquid chemicals we usually use to sterilize the equipment of instruments. Second one is gaseous chemical gas. We use chemical gas for sterilization or disinfection or fumigation. In that formalin, ethylene oxide, and plasma. But nowadays uh, we are using formaldehyde because formaldehyde is easily available and low cost even. But it it is hazardous too because formaldehyde or formalin is having carcinogenic activity if we use in large amount or we use in daily basis or we came in contact or we come in contact with formalin gas for long time, it will be hazardous because of its carcinogenic activity. Third one main is physiochemical. It mixed sterilization method. So this sterilization method, by this all types, we do sterilization and disinfection of operation theater of hospitals, laboratories, our house, our clinics. As I want to come on our basic point, basic uh, clinic instrument sterilization. So what we need to be with us in our clinic, what instrument we need to keep in our clinic. So first one is the sterilizer because we are going to sterilize our instrument and we are taking care of our instrument. So we need sterilizer. There are so many sterilizers available in the market, but uh, what we can keep sterilizer in our clinic. So here I have okay, I have these three images. This first one is double front autoclave, which usually used in hospitals because there are 2 to 3 drums we can keep in this chamber and we can sterilize at a time 3 drums of instruments and cloths, all of medical equipment. Second one, the image is single dramatically. I think this is more and it is good to keep in our clinic. And third one is also domestic pressure cooker. So domestic pressure cooker and our pressure cooker, the action, the working of this pressure cooker is near about equal to same. But here there is an indicator. So this indicates the temperature or the pressure of vapors in that sterilizer. We can see the pressure and we can maintain the pressure even. So the last one, domestic pressure cooker, it is used in our clinic. We can sterilize our instrument. We can sterilize our cloths, whatever we are using daily in our clinic. So I think this third one is domestic pressure cooker is more convenient to keep to sterilize our all equipment at our clinic setup. Then second one, this first one is electric sterilizer. So we often see everywhere, you see in clinics, in hospitals, even this sterilizer. We see this sterilizer. So what is the action? Or what is the working mechanism of this sterilizer? This sterilizer, we keep water in this sterilizer, and we see the plate, the cold plate, cold plate is there, and we keep our all instrument on that plate, and we start this sterilizer. So there is a water inside. So what is the action? The boiling point of I told you the boiling point of water is 100 degrees Celsius, and these sterilizers achieve this temperature, and we can sterilize our all instruments by this sterilizer. So this is the common usable sterilizer everywhere. Second one is the UV light sterilizer. So UV light sterilizer, whatever we use in hospital or clinic, that is sterile contents or sterile products. Most of the products are sterilized by this UV light sterilizer, but it is more cost effective than this electric sterilizer. So these are used in manufacturing companies or in uh, hospitals. So the first sterilizer, I think, is better to keep at our clinic setup. For I have given these images because what instrument and equipment we need to have at our clinic setup. In that third one, this is autoclave drum, and the fourth image is as instrument trays and kidney trays. These all instruments or these equipment we need to have at our clinic setup. I have these images with digital forceps to hold to give all these sterile instrument or things. Third one is scissor. We usually use. Fourth one is tongue depressor. Fifth one is a foreign body removal forceps. Very clinician if this foreign body removal forceps because sometimes patient come with the foreign body in the ear or foreign body in the nose. So we must have to have this instrument. So other instrument cannot work there. So this is a long, this is a long and tight edge. So we can hold the foreign body from here or not. And the gynecology instruments, which are generally used by gynecologists at their clinic because they see all patients and they need to have this because the clinical examination without this instrument cannot possible. So these instruments are also needed at our clinical setups. And other equipments like stethoscope or sphygmomanometer or pulse oximeter, we are using this regularly. Everyone is using this. Now the process of sterilization. We so these all instruments and equipment and how to sterilize this instrument and equipment because uh, we are using these instruments in day-to-day practice and we have to sterilize, must have to sterilize these instruments before using to the next patient. So what is sterilization? The definition of sterilization refers to a process that removes kills or deactivate all forms of life. Which life? Whose life? In particular, referring to microorganisms such as fungi, bacteria, viruses, spores, uncellular eukaryotic organisms such as plasmodium, etc. That means sterilization that totally kills the bacteria or the microorganism. So this is the sterilization. Now, what is disinfection? The disinfection means the destruction or removal of all pathogenic organisms capable of giving rise to infection. So destruction or removal is different than killing the bacteria. So I think so. The difference between sterilization and disinfection. In disinfection does not affect spore state of organism. So what is the spore state? The spore state of organism is the spores of organism remains there at the site of infection. Sometimes they are not killed by this disinfection or disinfectant, but they are remain there at the site of infection or at the site or on the surface of instrument, process, everywhere. So the difference is sterilization and disinfection, where more effective is sterilization, I think, because we are killing all bacteria and all microorganisms in sterilization method, where in disinfection method we cannot totally kill the bacteria or all microorganisms, but affects because it does not affect the spore state of organism. You can kill the some amount of bacteria, but some amount of bacteria will be there, remains there at the site. So, so again, these are the two types which are quoted in that we physical sterilization and chemical sterilization. So, what is the effective method in physical sterilization? Steam, a widely used method for heat sterilization in the autoclave. Your autoclave machine is the autoclave machine. We use that machine to autoclave the instrument and all medical equipment. Some autoclave, sometimes called a converter or steam sterilizer, because the steam is produced in the autoclave machine, and that steam that penetrates the deep and do the sterilization properly. The proper autoclave treatment will inactivate all resistant bacterial spores. Here, they have mentioned the bacterial spores. So, bacterial spores inactivate, and in addition to fungi, bacteria, and viruses, but is not expected to eliminate all prions which vary in their resistance. Second is the chemical sterilization, where chemical are used to sterilize the sterilization method, used in sterilization method. The chemical sterilization is the elimination of all viable microorganisms and spores using liquids, where liquid sterilants are used, chemicals are used, or gaseous compounds. I told formaldehyde gas. The method you use for chemical sterilization varies with the form of chemical you use. Means whatever you are using the chemical in the sterilization process, that will be the means the effect of that sterilization on microorganisms depend on chemical, which chemical you are using. So Nowadays, ethylene oxide and formaldehyde are used more to sterilize the equipment and all medical instruments. Now, this is the Spalding categorization of instrument. This is Spalding, the scientist who categorize the instrument. So, how do we select the instrument which is more hazardous or more contaminated and which is not more contaminated? So, the class critical, the first class is critical C, where enters sterile body side or vascular. What enters our whatever we are using the instrument on the patient's body, where that instrument enters sterile body side or vascular system. Uh, for example, when we are doing appendectomy operation, we go into the body or into the abdomen. That means we cut the abdomen and enters in the abdominal cavity. Here we need to sterilize or we need to take care of our instruments first. So this is the critical C, critical C class. The processing, decontamination, cleaning, followed by sterilization. Why this cleaning is first, come first? Because everything when we go to sterilize, we need to clean first everything. That means all our instruments, all our cloths, we need to clean first, then go to sterilization. Second is semi-critical. So what are the semi-critical? Where we use this instrument, we use this instrument when comes into contact with intact mucous membrane or non-intact skin. Where the intact mucous membrane and non-intact skin. When we use this our instrument in this area, this is semi-critical area. So what we need to do, we need to do decontamination, cleaning followed by high-level disinfection, HLD. So what is high-level disinfection? That is more than critical or uh, less than critical stage or less than critical class. Third one is non-critical, comes into contact with intact skin. That is non-critical. Uh, we can do sterilization by even sanitization and alcohols. By this method we can sterilize the area or we can sterilize the instrument. Decontamination cleaning followed by intermediate or low level disinfection. So there are types: low level disinfection, intermediate or high level disinfection. What are the chemicals we are using for sterilization and disinfection? There are common chemicals are there. The most common is ethylene oxide. We use ethylene oxide for sterilization. Second one is ozone. Third one is bleach. Fourth one is glutaraldehyde and formaldehyde. These are from aldehyde group. Glutaraldehyde, the brand name is Sidex. The formaldehyde is formalin. Phenaldehyde. So what is phenaldehyde? This is the aldehyde. The chemical is from aldehyde group, but available in solid. That means the formalin tablets are available in the market. The content is alloy gel. Next is hydrogen peroxide. We use hydrogen peroxide to sterilize the instrument and even our clothes. Then parasitic acid and silver. Silver nanoparticles we are using to sterilize the instrument. So these are a few terms which are coming in this sterilization process and disinfection process. That is antiseptics. We are using antiseptic solution, antiseptic soap. So, what are the antiseptics? Antiseptics are non-toxic for living tissue. That is why we are using for hand washing and used for skin disinfection to kill bacteria. That is microorganisms. Example: spirit, alcohol, iodine, hydrogen peroxide. These are the antiseptic solutions. Even iodine is Covidon iodine we are using daily for dressing the wound. Spirit even uh, we sanitize before giving injection. So disinfection of the area we can achieve the antiseptic solution. Then disinfectant. What are the disinfectants? Are toxic. Antiseptics are not toxic and disinfectants are toxic and corrosive used for non-living objects such as metal, stone, wood, and ceramics. Means to sterilize our instruments, we need to use this disinfectant. That is all chemical disinfectant. Where I told before slide that is chemical, all chemicals, that is formalin, ethylene oxide, and etc. Nowadays, we are using in this COVID-19 pandemic, that is sanitizer. Use lot of use of sanitizer. Everyone is using sanitizer. So, what is sanitizer? What is the action of sanitizer? What it contains? An antimicrobial agent that kills or render inactive 99.9% of all known bacteria, viruses, and fungi that are present on the surface, but they are ineffective against bacterial spores. Here, sanitizer is less effective than chemical sterilizer or chemicals which are used for sterilization. So here ineffective against bacterial spores. That means it is near about equal to the process of disinfection. Where disinfection process and the sanitization are equal because the bacterial spores are not killed by the sanitization. But the viruses and bacteria which are on the surface for 30 seconds we have to apply the sanitizer before we do the next or before we touch the next patient or everything. So 70% of ethyl alkyl kills 99.9% of the bacteria or viruses 30 seconds after application. So the time is very important. We need to keep the sanitizer on our hand for 30 seconds at least. So we should not to use sanitizer on the hands and immediately we cannot do the next thing or we cannot get by our hand, we cannot touch. So the time is important. Again, the term is bactericidal or germicidal. What is bactericidal? Bactericidal those which are able to kill bacteria. Example: beta-lactam antibiotics, glycopeptides, fluoroquinolones, and aminoglycosides. Secondly, bacteriostatic. It means the agent prevent the growth of bacteria. It means they cannot, they don't kill the bacteria, but they prevent the growth of bacteria. And what are they? Triglycerin, linezolid, macrolides, sulfonamide, and tetracycline. These all bacteriostatic uh, drugs we are using internally. We are giving, we prescribe the patient some antibiotic from macrolide group, from linezolid, from sulfonamide to prevent the bacterial growth in our body, in our blood. So these are the agents, or these are the these bacteriostatic agents and all medicines we give with our prior, we give it addition to inhibit the growth or to kill the bacteria. Again, the term is fungicidal, that is we are not equal to bactericidal. Here, the fungal pathogens are killed by fungicidal drugs. Fungistatics is the drug that inhibits the growth of fungal pathogens. Fungicidal, bactericidal that kills the pathogen, and bactericidal fungistatics, yes, they inhibit the growth of fungal pathogens. So I want to conclude. How do we achieve this sterilization? Here we saw the all methods by physical methods, chemical methods. Here the best method for sterilization nowadays is autoclave. So the first instrument we need to have is autoclave machine. The second, we need Sidex solution, because Sidex or glutaraldehyde, where we can keep the
मेरे को
instrument.
बोलायला
Hello. In Sidex solution, if it's not working, our sterilizer is not working, we can keep the instrument in Sidex solution to sanitize. So in chemical sterilization, the important and basic fast acting chemical for sterilization is Sidex. So we need to have Sidex solution also in our clinic, and other povidone iodine, phenols, these are always available. But we can sterilization of instrument, if we need to sterilize in emergency, that time we don't have time to sterilize for 15 minutes and 1 hour. So we can sterilize. The alternative option is chemical sterilizer, that is Sidex solution. We can keep our instrument in Sidex solution, and we can keep this instrument for even 2 to 3 minutes. We can keep out, and we can use this instrument uh, for next patient or for minor surgeries and all. So thank you very much. So thank you all of you for listening me, and thank you very much team e-learning Ayushala, and thanks Dr. Savan sir to given in the previous lecture given into the chapter. Thank you all of you. If you have some queries, you can chat.
Thank you, Dr. Sharad sir. For such an information session. Sterilization is importance in today's field for corona. For deactivates and ineffective. I request delegates, are there any questions regarding this session or lecture? You can ask them in the chat box.
Sir,
Dr.
हेलो
Sharad sir. Hello. Yes.
सर, एक क्वेश्चन है। हम ऑटोक्लेव्स के लिए स्टरलाइजेशन जैसे ऑटोक्लेव्स करते हैं स्टरलाइजेशन के लिए इंस्ट्रूमेंट के लिए।
हाँ
हेलो
बोलिए। हाँ
सर, हम स्टरलाइजेशन के लिए ऑटोक्लेव्स करते हैं यूज इंस्ट्रूमेंट के लिए। ओटी में हम केमिकल्स करते हैं। कैन वी मिक्स इट?
नहीं, we cannot mix this. The autoclave is different and chemical sterilization is different. So in autoclave,
मैं सर
हाँ बोलिए।
सर मैं क्वेश्चन ये पूछना चाहता हूँ कि हम स्टरलाइजेशन जैसे हम करते हैं, स्टीमर यूज करते हैं, तो क्या हम उसमें वो केमिकल्स ऐड कर सकते हैं
Yes,
जैसे
yes,
फॉर्मोलिन
yes.
एक्सेट्रा?
We can use chemical in autoclave machine. We generally usually use ethylene oxide sterilization is nowadays more effective. Nowadays,
इथिलीन ऑक्साइड।
yeah.
हेलो
There is one request to all
सर,
delegates. Put their questions in the chat box. Kindly put your questions or queries in the chat box. Dr. Sharad sir.
There is one question: how many times we can reuse siders? Yes. So here, sir, we can reuse siders. Even the packed bottle having their shelf life for even 2 years, but when we open the Sidex bottle and keep in the tray, we have to change the Sidex solution every 15 days. So we need to change every 15 days, and uh, next solution or we have to use the another solution, fresh solution for sterilization instruments.
I think there are no any queries or questions. So we'll conclude this session. Today's session. There are two announcements from PIRSHL. Tomorrow we are going to have a big session by Vaidya Manoj on anatomical aspects behind worm nomenclature at 12 p.m. Also, we are going to conduct advanced lecture series on various subjects in gynecology, Panchakama, Shastra, Shantitantra. It is going to be introduced shortly for the practitioners to enhance their clinical skills and for students to enhance their clinical knowledge. There is one question in the chat box.
Yes.
Sharad sir.
The question is there: boiling instrument for half an hour for PV examination is okay or not? Yes. So we have to boil the instrument in boiling or electric sterilization for half an hour is uh, essential to do PV examination or the gynecological instrument to sterilize the gynecological instrument, because I told you that the boiling point of water is 100 degrees Celsius and it goes at the 100 degrees Celsius, and uh, the instruments are totally sterile at this temperature. So you can use this instrument by boiling for half an hour.
Thank you, sir.
Thank you very much.
Thank you, sir, for such an informative session. We'll conclude our today's session and we'll continue tomorrow all of you at 12 p.m. For a lecture on removing aspects behind our lecture. Thanks, all attendees, and stay tuned for upcoming advanced lecture series. Thank you, all of you.